A contentious nomination: RFK Jr. for HHS Secretary. The nomination of Robert F. Kennedy Jr. for the position of Secretary of Health and Human Services has ignited a firestorm of controversy. His appointment has become a focal point of intense debate, reflecting the deep divisions within the country on key health issues. Kennedy, a well-known environmental activist and lawyer, is no stranger to public scrutiny. His career has been marked by high-profile legal battles and advocacy for environmental causes, earning him both staunch supporters and fierce critics. However, his views on vaccines, among other issues, have drawn sharp criticism from both within and outside the political arena. His outspoken stance on vaccine safety has particularly polarized public opinion, with many questioning his suitability for a role that requires unwavering trust in public health measures. His nomination by President Donald Trump has been met with a mixture of surprise, apprehension, and outright opposition. Trump's decision to nominate Kennedy is seen by some as a strategic move to appeal to certain voter bases, while others view it as a risky gamble that could backfire. It has set the stage for a heated confirmation battle. The Senate hearings are expected to be contentious, with both sides preparing for a showdown that could have significant implications for the future of public health policy in the United States. Kennedy's supporters point to his passion for public health issues and his commitment to challenging the status quo. They argue that his unconventional approach could bring much-needed reform to a system that many believe is broken. They see him as a potential disruptor who could shake up a bureaucratic and often inefficient healthcare system. His track record of fighting for environmental justice is cited as evidence of his ability to tackle complex public health challenges. They believe his background as an advocate for environmental health will translate well to the challenges of addressing public health crises. His experience in navigating regulatory frameworks and his willingness to take on powerful interests are seen as assets in the fight to improve public health. His critics, however, are vociferous in their opposition. They argue that his controversial views on vaccines and other health issues make him a dangerous choice for such a critical position. They point to his long history of promoting debunked theories linking vaccines to autism. This has raised concerns about his ability to effectively lead a department that plays a crucial role in managing public health crises and ensuring the safety of medical interventions. They fear his appointment would erode public trust in vaccines and set back decades of progress in public health. The potential impact on vaccination rates and public health initiatives is a major point of contention. His stance on other controversial issues such as abortion has further alienated potential allies and solidified opposition within the Senate. These positions have made it difficult for him to garner the bipartisan support needed for confirmation. The battle lines have been drawn, and the stakes are high. The outcome of this nomination process will not only determine Kennedy's future, but also signal the direction of public health policy in the coming years. The confirmation hearings promise to be a spectacle of political theater, with both sides digging in their heels and refusing to budge. The intense scrutiny and high emotions surrounding this nomination are indicative of the broader political climate. The outcome will have far-reaching implications, not just for RFK Jr.'s political future, but for the future of public health in America. The decision will reflect the nation's priorities and values in addressing health challenges and shaping the healthcare landscape. The hearings begin, dates, and committees. The first act in this political drama unfolded on January 29, 2025, as RFK Jr. sat before the Senate Finance Committee for his initial confirmation hearing. This powerful committee, tasked with overseeing healthcare policy, was the first hurdle in a multi-step process. The hearing, broadcast live across the nation, provided a platform for both pointed questions and impassioned defenses. A day later, on January 30, 2025, Kennedy faced a second round of questioning. This time it was a courtesy hearing before the Senate Health, Education, Labor, and Pensions Committee. While not directly involved in the confirmation process, the HELP Committee's hearing offered another opportunity for senators to probe Kennedy's views and qualifications. These hearings, however, were just the opening salvos in what promises to be a protracted and contentious confirmation process. With public opinion sharply divided and political alliances strained, RFK Jr.'s nomination hangs in the balance. The coming weeks will determine whether he can overcome the considerable opposition and secure his place at the helm of one of the most consequential departments in the federal government. The Department of Health and Human Services, a vast undertaking. The Department of Health and Human Services is a sprawling behemoth within the federal government, a colossal entity that plays a pivotal role in the lives of millions. Its reach extends far beyond the halls of Washington, D.C., impacting the lives of every single American from bustling urban centers to the quietest rural communities. With a staggering budget of $1.7 trillion annually and a workforce of nearly 90,000 employees, HHS is a complex web of agencies and programs, all focused on one overarching goal: the health and well-being of the American people. This immense budget underscores the scale and importance of its mission. Within HHS, a constellation of agencies tackles specific aspects of this vast mission, each with its own specialized focus and expertise. The Centers for Disease Control and Prevention stands as the nation's first line of defense against infectious disease outbreaks and public health threats, working tirelessly to keep communities safe. The Food and Drug Administration safeguards the nation's food supply and regulates the safety and efficacy of medications, ensuring that what we consume and the medicines we rely on are safe and effective. The National Institutes of Health, a global leader in medical research, spearheads the search for cures and treatments for a wide range of diseases, pushing the boundaries of medical science. The Centers for Medicare and Medicaid Services administers Medicare and Medicaid, providing health insurance coverage to millions of elderly and low-income Americans, ensuring that healthcare is accessible to those who need it most. These agencies and many others within HHS work tirelessly to improve the health and well-being of all Americans, striving every day to make a positive impact on the nation's health landscape. Vaccines and controversy, a history of opposition. One issue has come to define the debate surrounding RFK Jr.'s nomination: vaccines. His stance on this topic has been a lightning rod for both support and criticism. Kennedy's long-standing and vocal opposition to vaccines has drawn condemnation from medical professionals, scientists, and public health experts. These experts argue that his views undermine decades of scientific research and public health initiatives. His views, often rooted in debunked theories linking vaccines to autism, have been widely criticized as dangerous and irresponsible. The medical community has repeatedly emphasized that vaccines are safe and effective. Despite facing a mountain of scientific evidence to the contrary, Kennedy has repeatedly used his platform to sow doubt and distrust in vaccines. His social media posts and public speeches have amplified these controversial views. His organization, Children's Health Defense, has been a leading voice in the anti-vaccine movement, promoting misinformation and fear-mongering about vaccines. This has led to widespread concern among public health officials. This history has led to accusations that he is unfit to lead an agency tasked with promoting public health and protecting Americans from preventable diseases. Critics argue that his leadership could jeopardize public trust in health initiatives. Kennedy's supporters argue that he is not anti-vaccine but rather pro-safety. They believe his concerns are valid and that he is advocating for more rigorous safety standards. They point to his statements that all of his children are vaccinated as proof of his commitment to vaccines. This, they argue, shows that he is not against vaccines per se, but wants to ensure they are safe for everyone. However, his critics remain unconvinced, arguing that his past actions and statements speak louder than his recent attempts to moderate his views. They worry that his history of spreading misinformation could have lasting negative impacts. The issue of vaccines has become a litmus test for many senators, making it a potential deal-breaker for his confirmation. As the debate continues, the stakes for public health and trust in science remain high. In today's complex political climate, navigating a divided landscape requires a delicate balance. It's about understanding differing perspectives and finding common ground. The process is challenging, but it's essential for progress and unity. As we move forward, the importance of dialogue and compromise cannot be overstated. These are the foundations upon which a more cohesive society is built. Let's remember that despite our differences, we all share a common goal: a better future for everyone. In the midst of the confirmation process, there were voices of dissent from within the political establishment. Concerns were raised about RFK Jr.'s suitability for the role, with some questioning his past statements and positions. This internal opposition added another layer of complexity to an already contentious hearing. As the hearing progressed, questions about potential conflicts of interest surfaced. Critics pointed out RFK Jr.'s connections to various organizations and past advocacy efforts. These concerns brought into focus the delicate balance between personal beliefs and public duty. Despite the controversies, RFK Jr. laid out a series of proposed reforms aimed at addressing key issues. He emphasized the need for transparency, accountability, and a renewed commitment to public health. His vision was clear, but it remained to be seen if it would garner the necessary support. RFK Jr.'s journey to this point had been marked by both triumphs and challenges. From his early days as an environmental advocate to his current role in the political arena, his path was anything but straightforward. As the confirmation hearing drew to a close, the question remained, would his unique perspective and experience be enough to secure his appointment?